everyone, I'm Ruiling Chen. Welcome to our online course, Fundamentals of Nursing. Today, I'm going to talk about urinary elimination. We have 4 learning objectives. By the end of this session, students should be able to describe the anatomy of the urinary system, understand the factors that influence urinary elimination, identify problems and common causes of urine production and elimination. Urinary elimination, also known as micturition, voiding, and urination, refers to the process of emptying the urinary bladder. Passing urine is usually taken for granted, but when a problem arises, most people become aware of their urinary habits and the associated symptoms. First of all, let's review the anatomy of the urinary system briefly. Urinary elimination depends on the effective functioning of the kidneys and ureters in the upper urinary tract, and the urinary bladder and urethra in the lower urinary tract. The trigone is a triangular area at the base of the bladder. It is marked by the ureteric openings at the posterior corners and the opening of the urethra at the anterior inferior corner. Understanding the structures of the urinary system is very essential for nurses to ensure safe and appropriate care for our patients. Numerous factors affect the volume and characteristics of the urine produced and the manner in which it is excreted. Now let's take a look. Developmental factors. There are developmental changes in urinary elimination throughout the lifespan, including infants, preschoolers, school-age children, and older adults. For example, infants are born without urinary control. Because of immature kidneys, their ability to concentrate urine is minimal. For older adults, complaints of urinary urgency, frequency, or incontinence are common because of an enlarged prostate gland in men and weakness of the urethral sphincter in women. We will talk about these later. Psychosocial factors. For many people, various conditions such as privacy, environment, normal posture, sufficient time, and running water help stimulate the micturition reflex. For example, lack of privacy or suitable facilities may produce anxiety. People may be unable to relax abdominal and perineal muscles and the external urethral sphincter. As a result, voiding is inhibited. Fluid and food intake. The healthy body maintains a balance between the amount of fluid intake and output. Certain fluids, such as alcohol, increases water excretion by inhibiting the production of antiuretic hormone. Fluid that contains caffeine also increases urine production. By contrast, food and fluid high in sodium can cause fluid retention because water is retained to maintain normal electrolyte concentration. Medications. Some medications can affect the autonomic nervous system. They interfere with the normal urination process and may cause retention, such as anticholinergic medications and antidepressants and antipsychotic agents. Good muscle tone is important because it can maintain the stretch and contractility of the detrusor muscle. Then the bladder can fill adequately and empty completely. For instance, patients who require prolonged catheterization for continuous drainage may have poor bladder muscle tone due to disuse. Pathologic conditions and diseases, such as renal failure, heart failure, shock, and hypertrophy of the prostate gland, can affect the formation and excretion of urine. Some surgical and diagnostic procedures, such as cystoscopy, surgery on any part of the urinary tract, and spinal anesthetics, can affect the passage of urine and the urine itself. Normally, the adult kidneys produce urine at a rate of approximately 60 milliliters an hour, or about 1.5 liters per day. Most people void about 5 to 6 times a day. Now, let's discuss altered urine production first. Polyuria, or diuresis, refers to the production of abnormally large amounts of urine, more than 2.5 liters a day. Polyuria can follow excessive fluid intake, or may be associated with disorders such as diabetes mellitus. The terms oliguria and anuria are used to describe decreased urinary output. Oliguria refers to less than 400 milliliters a day or 17 milliliters an hour for an adult. Although oliguria may occur because of abnormal fluid losses or lack of intake, it often indicates impaired renal blood flow or impending renal failure, and should be reported to the doctor immediately. Anuria refers to a lack of urine production, less than 100 milliliters a day or no urine in 12 hours. Next, we shall go through altered urinary elimination. Irritable bladder includes urinary frequency, urgency, and dysuria. Urinary frequency is voiding at frequent intervals of small urine volume, about 50 to 100 milliliters. It can be caused by conditions such as urinary tract infections, UTIs, pregnancy, and stress. Urgency is the sudden, strong desire to void. The person feels a need to void immediately, although there may or may not be a great deal of urine in the bladder. Psychological stress and irritation of the trigone and urethra are the common causes. Dysuria means voiding that is either painful or difficult. It can accompany a stricture of the urethra, urinary infections, and injury to the bladder and urethra. Urinary incontinence, UI, is the involuntary passage of urine from the urethra. Common causes include UTIs, pregnancy, cerebrovascular accident, spinal cord injury, restricted mobility, psychological causes, and leakage when coughing, laughing, and sneezing. Urinary retention means the inability to urinate voluntarily. Then urine accumulates and the bladder becomes over-distended. The patient will complain of lower abdominal pain, pubic discomforts, and frequent voiding of small urine volume, about 25 to 50 milliliter in an adult. The bladder is firm and distended on palpation and percussion. Common causes include prostatic hypertrophy, recent anesthesia, recent perineal surgery, presence of perineal swelling, medications, lack of privacy, or other factors inhibiting maturation. In this session, we talked about urinary elimination and the factors that influence it. Normally, the kidneys produce urine at a rate of approximately 1.5 liters per day. Altered urine production includes polyuria, oliguria, and anuria, while altered urinary elimination includes urine frequency, urgency, dysuria, incontinence, and retention. Here are the references. Thank you for joining us. See you next time. Bye-bye.